In this video, we are going to talk about intermittent catheterization, or also called straight or self-catheterization, and what this looks like if you are a female. The learning objectives are listed above. We'll discuss needed supplies, steps to follow, tips for caregivers who might be assisting you, and when you should call your doctor. To start out, here are some examples of the supplies that you would need to complete self-catheterization. Up here is the catheter itself. This is usually a clear or red rubber tube. It's also possible and optional that if you would like an extension tube for this so it can reach the toilet, then you can also use that as well. Make sure to have some kind of urine collection unit, so this could be a catheter bag, or it could be something like a jug, bottle, urinal, which can attach to the side of a bed, wheelchair, or chair, or it could even just be held between your knees. If you aren't using some kind of collection unit like that, then like I said, you could always be doing it over a toilet or bedside commode as well. The sterile drape and the absorption pad are both optional as well. These would be just to help keep the area clean and dry, and then limit the cleanup that you would have to be doing afterwards. Something that's not pictured here, which is really a needed supply, is some kind of water-soluble lubricant, such as a KY jelly or Surgilube, but do not use Vaseline. Here are your steps to follow to complete self-catheterization. You may catheterize yourself while sitting on a toilet, in a wheelchair, in bed, or while standing. Use a long catheter with an extension tube if you do self-cath from a wheelchair. Wash your hands well with soap and water, or use an alcohol-based hand sanitizer. Take the catheter out of the plastic bag. Put a small amount of lubricant on the tip and about 2 inches up the catheter. Place it on a clean towel within easy reach. Now you can separate the skin folds of the labia with your second and fourth fingers. For example, your hand would look similar to this. Be sure to wash the urinary opening, or also called the urethra, with soap and water. Keep the fingers that you have holding the labia folds open. You can find the urinary opening just above the vagina by using the middle finger from the same hand. Using a mirror to help see this area might be helpful for you. Now, using the other hand, you can pick up the catheter. Put the catheter tip into the urinary opening next to your finger. You can push the catheter in about 2 to 3 inches until urine flows freely. At this point, you can let the urine flow into the container or the toilet. An extension tube attached to the end of your catheter will give you the extra tubing needed to reach the toilet from your wheelchair. When the urine stops flowing, take some deep breaths or press on your lower abdomen. Slowly pull the catheter out. Continue to take deep breaths or press on your abdomen, but stop pulling the catheter out whenever urine starts flowing again. Repeat this step until urine stops. Once the urine stops flowing, you can pinch the end of the catheter to keep urine from spilling onto your clothes or the area around you. Slowly take the catheter out, and at this point, you can wash your hands with soap and water or that alcohol-based hand sanitizer. If you are a caregiver who catheterizes someone else, then you would follow the same process that we just described. Have the doctor or nurse walk you through the steps and ask any questions about anything you don't understand. Be sure to wash your hands before and after, and keep all of the supplies clean to prevent infection. Ask the person if they're having any pain or discomfort during the process, and be sure to watch for signs of infection. You should call your doctor if you're having any problems or having these signs of infection, such as cloudy or foul-smelling urine, chills or fever, leaking of urine in between catheterizations if this is not normal for you, if you're not feeling well, feeling tired or weak, if you're having pain or tenderness across the lower back, increased muscle or bladder spasms, red or swollen urinary opening, or if you're not able to pass the catheter through to the bladder. If you have any additional questions or concerns about how to complete self-catheterization, then please reach out to your medical team.